Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Pregnancy stretch marks, anyone? All right, ladies, let's be real. That irritating skin scar that no one wants, but some of us may already have from puberty. Learn about how to prevent them by understanding what a stretch mark actually is in this episode of Pregnancy Pukeology Podcast, episode 27, Pregnancy Stretch Marks, Prevent and Learn the Best Stretch Marks Cream. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea and vomiting or headaches now. Or just place your No More Nausea band on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped in 2 days free on Amazon as a Prime vendor. And remember, your little ones are always taken care of by No Mo bands with No More Nausea Kids, and get them sleeping comfortably every night, naturally, with No Mo Sleepless Nights Kids, the newest version made for women with small wrists too, all found at your local CVS. You want to hear some pregnancy humor that may just make you want to pee your pants? Stay tuned, because with hilarious stories like airport face flush, highway blues, and Freaky Friday. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind what is a stretch mark, how are the two different cases and classes of stretch marks, and what can be treated for each one of them, plus giving you 8 natural ways to prevent stretch marks during your pregnancy.
The science of puke, pukeology.
What are stretch marks? Well, stretch marks, medically known as striadentia, are an abrupt change in collagen and elastin of the skin, which will result in a type of scar that causes these two skin chemicals to rupture. The skin attempts to heal, and then the stretch mark results from a rapid change, whether that's weight gain, weight loss, or if you're on like chronic corticosteroids for disorders like Cushing's disease or Marfan's. Hence why we women are very prone to them, especially during pregnancy. But men and women with different types of growth spurts during puberty or weight training where there is rapid muscle growth and movement can all result in the exact same experience, stretch marks. The beginning of a stretch mark will appear colorful. And I say that because it depends upon what color your skin is, right? So it's either red, purple, pink, reddish brown, or dark brown, depending on every person's skin tone. Early stretch marks feel a little raised. They can be very, very itchy. This is what we actually call striae rubeae. It's when the color starts to fade with a little bit of time. Then they become that white-looking stretch mark that most of us are accustomed to seeing, and that's actually called striae albae. It is a narrow band that actually feels like it kind of sinks into and forms the stretch mark as it becomes depressed. Now, most of the time, the itching factor goes away because it's considered a chronic skin state. Remember that when it is that striae albae, or when it's basically in there pretty darn good, they're pale, atrophic, permanent, and then again, they're wrinkled. So they're this whitish-ish line. Now, pregnancy stretch marks, again, not uncommon in pregnancy, but most of the normal common areas that you're going to see them is your boobs, your breast, abdomen, buttocks, your thighs, knees, and even your calves. I know that sounds crazy, ladies, but you have to remember, sometimes as we get into the 3rd trimester, sometimes it starts at the 2nd, but again, we tend to hoard a lot of water weight. So if you're on your feet all day, you're going to get very edematous, meaning that there's going to be so much stretching, especially in the calves and the lower extremities, because your body is just pulling that amount of fluid down by your feet. Hence why they say some of us women, while we are pregnant and ready to pop, we have what's called cankles. They're not real ankles because they're the exact same size as our calves. So when these skin areas are subject to rapid change, collagen production and fibroblastic activity and blood is actually decreased. So the decrease in the amount of collagen, which is that stretchy stuff that makes the skin nice and pliable, which we all know as we get older, unfortunately, the collagen decreases, hence why we have wrinkles, and that's the reason why Botox is like the next best thing when it comes to women of all of our ages. But the fibroblastic activity, again, that is the fibrous activity that lies underneath of the actual skin itself, and then blood, that gives us the pink look, right? So that's the reason why we wear blush, ladies, because we want to show that our skin, especially in our face, has got this nice pink hue because of blood getting to it. Well, guess what else happens? When you start to have these decrease in production for your stretch marks, it increases inflammation to the area. So you're not really getting the blood flow that you need to that area as well. So treatment options are very different. We'll talk about more of this in the tips and tricks section, but I do want to touch upon it that when most treatment options include an early phase of the stretch marks, and what you can do is you can hydrate the skin. This is that preventative mechanism, basically giving your skin more water, decreasing the inflammation so the blood flow can get to and return from, and then that also increases and supports the new increase in collagen needs. Are stretch marks genetic? It's a yes and no. So you are at higher risk or a higher propensity to develop these narrow bands on the skin during pregnancy if your family has a high propensity to having stretch marks. You kind of will know if you went through puberty. I'm a Latina female, so my booty grew quite a bit along with my hips. And so I noticed that even during puberty, I got a few stretch marks. But clinically, in my family, nobody else has them. So I was very lucky. I never got them on my breasts or on my abdomen when I was pregnant with both of my beautiful babies. So another thing genetically is hormones. Fluctuating hormone levels do also seem to play a role when it comes to whether or not you are going to have stretch marks if your mom did or did not. So in the next set, I'm going to end up giving you some incredible natural tips as well as other tips that you can visit other different types of doctors in order to help to remove those stretch marks because they're really ugly and unwanted. Let's talk about that in the very next section. But first, hold on and get ready. Just don't take a sip of water because you might spit your drink out with these hilarious puke stories.
Throwing up on a Tuesday? One puke story.
The worst was barfing in a bathroom of an airport. I was clearly super pregnant, and unfortunately, when you try to puke inside of the airport toilet, it automatically keeps flushing. I guess my face kind of looks like my butt, and while I was heaving, I kept peeing my pants as well. Guess what? This girl already checked her bag through, so I had no clean pants for the next 6 hours. Thank you. No name. I really appreciate the story. I was giggling my face off when I heard this one because I too understand about a lot of traveling and can't even imagine what I would do if I was pregnant again barfing. Thank you so much for that hilarious puke story. So I got really good at throwing up into plastic baggies while driving, but I guess I really didn't pay attention in physics class. So one time when I was driving 70 miles an hour down the freeway, I always made sure that I would roll down my window. The problem is that when you throw up, even if you try to throw up into a plastic baggie, your plastic baggie will get sucked out of the car window, and then it's like you're puking on a wall. As soon as I tried puking, getting my head out of the actual window, the puke came all back on myself, and it was absolutely disgusting. Anaya from Washington, thank you so much for the hilarious puke story. I'm not going to lie, ladies. I have tried puking, but again, for a completely separate reason. Why never consume 2 bottles of wine on your own. And that was all on Alligator Alley. Highly not suggested. And by the way, just because your head's out the window doesn't mean the puke will not get back on your face. So I thought I was over this sickness part when I was getting a little frisky with my husband. I don't want to be too graphic, but let's just say we found out the hard way that pregnancy really gives me a strong gag reflex. It was very, very bad. I no longer think of my husband in that super sexy way, and I have a feeling before I deliver, he's not going to ask me to go down on him ever again. Another no name with a hilarious puke story. Do you have a puke story you can't just wait to share with us? Please send it to me. Pukeology, Pukeology @nomonaja.com, or tweet us at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
How can I get rid of stretch marks? That is probably one of the most common questions that I've ever gotten, especially from pregnant women. Unfortunately, stretch marks are forever. That means permanent, but treatment can make them a lot less noticeable, and they can alleviate the itch, especially if they're in the first stage, where what we call the temporary stage, or again, we also call that what we said where it was very colorful, that's striae rubrae. So if you are pregnant though, and breastfeeding while listening to this podcast, please speak with your OB. Again, because of the fact that a lot of the products contain retinol, which is found in many of these creams and can actually be harmful to your baby. Remember that your skin is the largest organ group, so it does get into your bloodstream, meaning it can get into your breast milk as well as it can get in to the baby that's currently developing. Best stretch mark cream. Now, I'm not going to tell you guys a name brand because I'm just not sponsored like that. But what I am going to tell you is what to look for with inside of these creams, because there's a ton of creams and lotions and gels that are on the market, but not one alone seems to help individually. So some good tips to help you get the full potential out of your anti-stretch mark cream are what I like to call the No-Mo stretch mark hacks. Number 1, use the product on early stretch marks when it's still that reddish, pinkish type color, because you know it hasn't set in yet, right? So this is at the time period where your body is actively forming kind of like an immunity towards it. When you get a scar, imagine a cut. So it's like a fresh cut. And so upon doing this, the treatment options have little to no effect on mature stretch marks. So again, if you're trying to get rid of ones from when you were a sassy little teenager, sorry, sister, those memories are forever, right? So they're going to be on your body. And we'll talk about a little bit later what types of lasers and things like that we can actually do to help it, to reduce the image of it. So massages. Massaging the product into the stretch mark really will help. It helps to take effect because it gets in there more. It gets into the different striations. So get in there. Now apply the product every day for weeks. I know, sounds crazy. It may take weeks to see the results. Even though your skin does have a regenerative type tissue to where the bottom layer comes all the way up to the top, hence called epidermis, because that's at the very end and sloughs off. Again, this period of time is from the basal, once it's already created, all the way to the top. It's a little over a week's period of time. So don't expect to get any results any sooner than at least 2 weeks. Tretinoin is actually a prescription retinoid that has shown that people put inside of prescription creams. And when they clinically utilized it for 24 weeks, these patients had noticeably less stretch marks versus their control. And actually, because the stretch marks were young, the control group, which didn't use any cream, actually had their stretch marks grow. So again, it will grow. Think of it like a stream going into a lake. The stream is going to take the path of least resistance. And let me tell you, if it's already cut and carved, it's very easy for them to grow out in that way, especially if there is a large weight gain or weight loss to the area. Now, retinol. This is one of the ones we were talking about, another type of retinoid. This may also help with fading early stretch marks. And what we've also found is that dermatologists now have many different cool techniques to minimize the stretch marks. But again, it won't get rid of them entirely. Things like chemical peels, laser therapy, utilizing pulse dye lasers, microdermabrasions, which some of you guys probably do get on your face as is. Think of it like a facial, but for your everyday skin. Radio frequency, or ultrasound. What we're trying to do is cause skin resurfacing. We're trying to actually stimulate the collagen production to rejuvenate the damaged skin, create new skin, better skin that has much more of the collagen effect so it can really push up to the surface. Now, how to prevent pregnancy stretch marks. Dun, da, da, da. Get your notebook and pen out immediately. These are home remedies for stretch marks that can actually help you prevent from getting them. The first couple are actually going to be for the moisture, the hydration of the skin. Almond oil, cocoa butter, olive oil, shea butter. These are all natural emollients, and I say that because they will help to hydrate the skin. The best time to put it on is when your pores are able to absorb the most, so that is when right after you get out of the shower, put some on. I've suffered with eczema my entire life, so I know my whole moisturize routine. It goes from the top of my head all the way to the bottom of my feet. And when I was pregnant, I added a little bit more. So I ended up putting on the oil, or the type of, for me it was an almond oil and then an olive oil, put that all over my tummy. And then also your butt too, ladies. You got to make sure your booty grows. We used to joke that I looked like I had twins coming out the back and one coming out the front. So again, your booty will grow during pregnancy, especially if you're having a girl. We actually have a baby predictor Pregnancy Pukeology Podcast. So if you ever are curious to see like, hey, is there anything that I can do to make a girl versus a boy? And again, that's something that you may or may not. I call it the baby gender predictor. Am I having a boy or girl? Go check out episode 14. It will definitely make you giggle, but there's also some Chinese, old school Chinese stuff, King calendar, that I actually put up there. And you can see whether or not that, depending upon your age and when you conceived, whether or not you're going to have a boy or girl. But I do have to say from personal experience, a girl will cause your booty to go outward. Okay, so now that we've talked about the actual rehydration and the emollient factor, let's go to the next couple, vitamin E with chamomile. So both of these act as an anti-inflammatory, and so because it's an anti-inflammatory, it decreases that itching that's currently being seen, and it allows for more blood flow to the area. Centinella, Centella, an herb that actually contains hyaluronic acid, is something else that can actually rejuvenate the skin. Hyaluronic acid can now be found in many different creams and gels, and the thought is that when you create this crevice, right, it actually helps to push in and push that up so that the striation is not as great or as grand. Now, fix yourself from the inside out. Please eat plenty of vitamin C. Vitamin C enriched foods are great to help your skin tone nice and fresh and clean. You want to feel refreshed, right? That's why you always see people put those vitamin C, like oranges, peels on their eyeballs. Well, make sure that you're eating it too and that you have a good, well-balanced diet. Watch your weight. I hate to say this to pregnant ladies, but try to stay within that 25 perfect pound range that your OBGYN tells you about, and make sure that it's 25 pounds within your pre-pregnancy weight. I know that you will be weighed every single time and you'll be checked, but if you're really curious to see how much you should be weighing, depending upon different conditions, whether or not you're having twins, check out episode 12, Pregnancy Pukeology Podcast, Pregnancy Weight Gain. It really will give you a better idea as of why we give you these guidelines, and then most importantly, how to achieve it. So what are those tips that you can do? What are the different snack options that are healthy and good for you and baby that keep you stretch mark free, but also will help? And then the last thing is self-tanner. So camouflage, you can camouflage them, but it won't necessarily get rid of them. But please do not above all else, don't go to the tanning bed. You shouldn't be going to the tanning bed while you're pregnant anyway, but they can actually make stretch marks more noticeable because of the fact that, remember, they're sucking out and decreasing the hydration that's actually in the skin. But even more importantly, there's no extra collagen to that area that's being produced. So when you are sucking out the actual moisture, you're really grinding it in there. So again, no visits to those tanning beds. I want to thank you guys for joining me. Again, now you know the science behind stretch marks, hacks to help diminish the 2 different types of stretch marks, and 8 natural ways to prevent pregnancy stretch marks even before they start showing up. Through these clinical knowledge, I hope I was able to give you the answers that are the best information that pregnancy has to date. If you love me, Dr. Pukeology or Pregnancy Pukeology Podcast, let me know. Tell me with a 5-star rating or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pukeology Podcast and Pregnancy, episode 27. Pregnancy stretch marks? No mo. Prevent and learn the best stretch mark cream.
Pukeology Podcast. Edutainment at its finest.